Ever wondered why your skin suddenly breaks out into red itchy patches? Could it be psoriasis? This common long-term skin condition affects millions of people worldwide and might be less well known than other skin diseases, but its impact is just as significant. Psoriasis, in a nutshell, is a skin disease that causes red, itchy, scaly, or bumpy patches. These patches commonly occur on the scalp, elbows, knees, and trunk. While there's no known cure, many ways exist to manage the symptoms. But what causes psoriasis? The answer lies in our immune system. It's an autoimmune disease, which means our body's defense system starts attacking our own cells. In the case of psoriasis, the immune system mistakenly speeds up the growth cycle of skin cells. Now, you might ask, why do people get psoriasis? While the exact cause remains unknown, it's believed that genetics and environmental factors play a significant role. So, if someone in your family has psoriasis, there's a chance you might develop it too. Psoriasis can develop at any age, but it most often starts between ages 15 and 25. It's a lifelong condition that can affect the quality of life, causing discomfort, pain, and even embarrassment. Diagnosing psoriasis typically involves a medical examination of the skin, nails, and scalp. If the diagnosis is uncertain, a skin biopsy may be needed. Once diagnosed, medical treatments are available to help manage symptoms. These treatments range from topical creams to light therapy and even systemic medications for severe cases. In addition to medical treatments, natural remedies also exist for managing psoriasis. These include aloe vera, fish oil, and even dietary changes. However, it's crucial to consult with a healthcare professional before starting any new treatment plan. To wrap things up, psoriasis is a long-term skin condition caused by an overactive immune system. It's often hereditary and can greatly impact an individual's quality of life. But with the right treatment plan, including medical treatments and natural remedies, managing the symptoms of psoriasis is possible. Remember, while there's currently no known cure for psoriasis, many people have successfully managed their symptoms and lead fulfilling lives. If you suspect you have psoriasis, seek professional medical advice. Knowledge is power, and understanding your condition is the first step towards managing it effectively.
What is psoriasis, you might ask? It's a chronic inflammatory skin condition, and no, it's not contagious. It affects a considerable slice of the population in the USA and other Western countries, about 1 in 5 individuals to be exact. Psoriasis shows up in various forms, but the most common type is plaque psoriasis. This type accounts for about 80% of all psoriasis cases. Plaque psoriasis is known by reddish patches of raised skin covered in silvery white scales. These patches are often found on the elbows, knees, scalp, and lower back. But plaque psoriasis isn't the only type. There's also guttate psoriasis, characterized by small red spots on the skin. This type is often seen in children or teenagers who have had streptococcal infections. Then there's erythrodermic psoriasis, a type that causes widespread redness, severe itching and pain. It only affects about 1% to 2% of psoriasis patients, but can be potentially life-threatening in severe cases. Inverse psoriasis, another type, manifests as smooth red lesions forming in skin folds, such as the armpits and genital area, and can cause significant pain. Finally, there's pustular psoriasis, which presents as red patches with white pustules at the center. It's a less common type, occurring in less than 5% of sufferers, usually in adults. The discomfort caused by psoriasis can range from mild to severe pain. Symptoms include itching, cracking, and bleeding of the skin. The severity of psoriasis determines the treatment recommended by medical professionals. They categorize it as mild, moderate, or severe based on the percentage of the body covered by lesions. If the lesions cover 5% to 10% of the body, it's considered mild. If they cover 10% to 20% of the body, it's moderate. And if they cover more than 20% of the body, it's severe. While some individuals experience mild annoyance with minor symptoms, others may face severe pain, disfigurement, and disability, requiring hospitalization for treatment. Psoriasis is a lifelong condition with no cure, often recurring intermittently throughout life. This situation necessitates individuals to manage and live with the condition. So to recap, Psoriasis is a chronic, non-contagious skin condition that manifests in several forms. It affects a notable portion of the population and can range from mild to severe, with various symptoms and discomfort levels. It's a lifelong condition, and while there's no cure, it can be managed effectively with the right treatment and lifestyle adjustments.
Ever wondered why some folks seem to have a never-ending battle with their skin, while others appear to have hit the genetic jackpot? Well, it's not as simple as it seems. You see, our skin is a complex organ, and one of the most misunderstood conditions that can afflict it is psoriasis. For the longest time, psoriasis was seen as a condition affecting only the epidermis, the uppermost layer of the skin. However, recent research has started to flip this narrative on its head. It turns out that psoriasis digs much deeper than the surface of our skin. It's a condition that arises from glitches in the immune system when certain immune cells go rogue. Now, under normal circumstances, white blood cells or T cells are the good guys. They churn out antibodies, ready to repel any bacteria or viruses that dare to invade. But in individuals with psoriasis, these cells seem to get a little confused. They start to fight off imaginary infections, or try to heal wounds that simply don't exist. They do this by creating an excess of new skin cells to fend off these phantom invaders, or repair the non-existent damage. This overproduction of skin cells leads to the formation of plaques or skin lesions that are a characteristic of plaque psoriasis. To give you a sense of the scale, consider this. For someone who is perfectly healthy, the average skin cell has a lifespan of about 28 days. But in psoriasis sufferers, their immune system is churning out cells so rapidly, they mature in as little as 3 to 6 days before surfacing. Because these cells aren't dying off quickly enough, they accumulate on the skin's surface, layer upon layer, forming those distinctive psoriatic plaques. So, thanks to this research, we have a clearer picture of what causes psoriasis. However, the mystery isn't fully solved yet. We still don't know why some people are more susceptible to psoriasis than others. There are a few factors that seem to increase the likelihood, but the exact reasons remain a puzzle. But as we continue to unravel the complexities of the human body, we're getting closer to understanding and hopefully finding more effective ways to manage psoriasis. So next time you see someone struggling with their skin, remember, it's not just about what's on the surface. There's a whole lot more going on underneath, and it's a battle they didn't choose to fight.
Have you ever wondered why people get psoriasis? Welcome to the world of genetics and psoriasis, where we'll delve into the mysteries behind this common skin condition. Psoriasis, a chronic skin condition, is often thought of as a genetic disease. However, the relationship between genes and psoriasis isn't as straightforward as you might think. Although research shows that around 30% of people with psoriasis have a family history of the condition, many people with psoriasis have no known relatives with the disease. And interestingly, many people with a family history of psoriasis never develop the condition themselves. So, if psoriasis isn't purely hereditary, what's going on? Well, researchers have discovered that certain genetic combinations and mutations can make a person more likely to develop psoriasis. At present, they've identified 9 different genetic mutations that might contribute to the development of psoriasis. One particular mutation on chromosome 6, known as SORAS1, seems to play a significant role. This mutation appears to influence the behavior of T cells, a type of white blood cell, which is directly linked to the development of psoriasis. But here's the catch. Not everyone with the SORS1 mutation develops psoriasis. In fact, for every person with the SORS1 gene that develops psoriasis, there are 10 others with the same gene who do not develop the condition. Moreover, some of the genetic mutations linked to psoriasis also have connections with other immune-mediated conditions, such as type 1 diabetes and rheumatoid arthritis. This means that a person with a certain genetic mutation might be more prone to psoriasis, but could instead develop diabetes or rheumatoid arthritis. So, while having a family history of psoriasis can increase your risk, it doesn't guarantee you'll develop the condition. The genetic factors contributing to psoriasis are complex and still not completely understood. To sum up, while genetic mutations play a role in the development of psoriasis, they are not the only factor. Many people with the same mutations do not develop the condition, and some of these mutations are also linked to other health issues. It's clear that our understanding of psoriasis is still evolving, and future research will undoubtedly shed more light on this mysterious condition. Thank you for joining us today as we explored the complex relationship between genetics and psoriasis. We hope this has given you a better understanding of why some people develop psoriasis and others do not. Remember, knowledge is power, especially when it comes to understanding our own health and well-being.
Have you ever stopped to consider how a skin condition like psoriasis could impact a person's quality of life? Psoriasis, a common skin disorder, is more than just a physical ailment. It carries with it a significant emotional and psychological burden, often leading to anxiety, stress, loneliness, and a loss of self-esteem. This skin condition typically develops during the teens and early 20s, a time when individuals are acutely aware of their appearance. The resulting psychological impact can be profound, with individuals feeling unattractive and unpopular due to their condition. In fact, studies have found that individuals with psoriasis are 3 times more likely to contemplate suicide than those without the condition. Embarrassment is a common sentiment among those with psoriasis, particularly when dealing with visible symptoms like flaky skin or scalp psoriasis. Misconceptions about the condition, such as the incorrect belief that it's contagious, can exacerbate these feelings, leading to social awkwardness and hesitancy in physical contact. But the impact of psoriasis extends beyond the emotional and psychological. It also disrupts daily life, limiting the ability to perform tasks and activities. According to the National Psoriasis Foundation, millions of working hours are lost annually due to this condition. Many individuals find themselves having to modify or even discontinue their daily routines, leading to frustration and a sense of limitation. Physically, psoriasis can cause itching, cracked, and bleeding skin, along with chronic pain. Nail psoriasis in particular can be extremely painful, adding to the overall burden of the condition on an individual's well-being. So, to wrap up, psoriasis is not just a skin condition. It has a profound impact on an individual's quality of life, affecting them psychologically, emotionally, and physically. This underscores the importance of comprehensive management and support for those living with psoriasis. It's not just about treating the skin, it's about treating the whole person.
First on the list are topical treatments. Think of anthralin, a substance that works by normalizing skin cell growth. However, it's not without its drawbacks, as it may cause skin irritation and leave permanent stains. Then there's coal tar, which effectively treats inflammation, scaling, and itching, albeit with an unpleasant odor and potential for skin irritation and staining. Moving on to systemic treatments, we find acitretin, an oral medication derived from vitamin A. It's effective for severe psoriasis, but it can cause headaches, elevated lipid levels, and hair loss. Cyclosporine is another option, an immunosuppressive drug used for severe plaque and nail psoriasis, but it carries severe side effects like potential kidney damage. Methotrexate, a chemotherapy drug, can be effective for moderate to severe psoriasis. However, it requires careful monitoring due to the potential risk of liver damage. Lastly, we have phototherapy and laser treatments. UV light therapy, either UVA or UVB, is effective but requires multiple sessions and increases the risk of skin cancer with long-term exposure. Laser therapy effectively targets lesions but may cause pain, skin darkening, and scarring. To sum it up, every psoriasis treatment has its own set of benefits and potential drawbacks. While medical treatments offer relief, they come with potential risks and side effects. Natural alternatives should be considered first, especially for milder cases, before resorting to powerful pharmaceuticals. In cases where natural methods are ineffective, medical treatments may be necessary, albeit under strict medical supervision. Remember, it's essential to weigh the benefits against the risks and explore natural options before opting for chemical-based treatments. Managing psoriasis is a journey, one that requires knowledge, patience, and wise decision-making. Understanding the treatments available is a crucial part of that journey. So, stay informed, stay proactive, and remember, you're not alone on this journey.
Does living with psoriasis feel like a never-ending battle? Do you yearn for natural treatments that can offer relief without the side effects of medication? Today, we explore the world of natural treatments and how they can help manage psoriasis symptoms. Acupuncture, an age-old Chinese practice, is one such alternative. Western practitioners believe that by inserting needles at specific points on the body, it can alleviate the discomfort of psoriasis. Although it might necessitate several sessions, Acupuncture is a safe method, even for those with a fear of needles, thanks to electric probes. Another approach involves dietary adjustments. Consuming a balanced, nutrient-rich diet can support overall health and potentially manage psoriasis symptoms. Foods high in nutrients like leafy greens, proteins, and folates can help address potential nutritional deficiencies linked to psoriasis. Also, cutting down on caffeine, alcohol, refined sugars, and gluten, while increasing the intake of fruits, vegetables, and oily fish, can support a psoriasis-friendly diet. Natural topical treatments also offer promising results. Oats, for instance, have soothing properties that can calm irritated skin when used in baths or as lotions. Aloe vera, known for its skin healing properties, can be applied as a cream or consumed as juice to promote skin regeneration. Other options include apple cider vinegar, capsaicin derived from cayenne peppers, and tea tree oil, all of which can help manage psoriasis symptoms. Supplements also play a role in managing psoriasis. Milk thistle, for instance, inhibits T-cell production, which can be beneficial for psoriasis sufferers. Oregano oil, with its antimicrobial properties, can help prevent infections associated with psoriasis. Turmeric, known for its anti-inflammatory properties, can help reduce inflammation, pain, and swelling. Some forms of shark cartilage have also shown promise in delaying the formation of new blood and skin cells, although their long-term effects are still unknown. In conclusion, the world of natural treatments offers a myriad of options to help manage psoriasis symptoms. However, remember that individual responses can vary, and it's crucial to consult with a healthcare provider before embarking on any new treatment regimen. Natural treatments can provide a safe and effective alternative, giving hope to those seeking relief from psoriasis.